University Hospitals of Morecambe Bay, covers about 1,000 square miles. The hospital runs out of 3 main sites, and we have a number of really big transformation programs. That's about transforming the way healthcare is delivered across the health geography so that it delivers better outcomes, and then building up the technology and the people around that. When I joined the organisation, there was siloed data, a difference between what the end users or management and clinicians were looking for and what they actually got. Concerns around data quality, ease of access. So, timeliness of analytics and reporting. We've worked very closely with Qlik and with Catalyst to grow our technology platform, improve our tooling, focus on solutions, and it sort of built iteratively from there. We brought in QlikView, and as the organisation's confidence in using data analytics to drive the business has increased, we've moved to Qlik Sense, then on to Qlik Sense SaaS and the wider ecosystem. I'm a really strong advocate and strong believer in cloud first. So I think the opportunity is here right now for all organisations to rapidly modernise their analytics platforms. What I refer to as a SaaS analytical blueprint. We link up Snowflake with Qlik Sense SaaS, and that provides a responsive and flexible analytics platform, taking data from primary care, community services, acute care, third sector, mental health care, and other cloud-based data stores. Then we're presenting it through clinical and operationally focused solutions. The delivery mechanisms and underlying governance of being able to use Qlik Sense SaaS to deliver analytics across a region, across organisational boundaries within our integrated care system has been really important, and fundamentally has allowed us to reach other organisations, other users who just would have been out of scope previously. We know that our ability to be able to pipe data, make sense of it, and present it in a way that means something to a clinical member of staff so that they can take a decision saves people's lives. The kind of velocity of data, the ability to ingest it, make sense of it, and to represent it and augment it in a way that means something so they can take action. Yeah, that's proven a massive value, obviously. And we're getting a really strong pull from our clinical teams for exactly that type of capability. So I think having the right platform in place, cloud-based, being able to move data quickly and with in a secure way is important. When I last counted, we had over 250 Qlik Sense apps, everything from our analytical command centre to emergency care, to elective care, to theatres, outpatients, inpatients, waiting list validation and electronic prescribing apps, which are supporting staff personal development, training, completement of appraisals, to corporate support, governance, procurement, and so on. There's real benefit in being able to excite an organisation, bring them with you on a journey, and deliver really rapid solution. Our Qlik Analytical Command Centre, or Athena, has been a really successful programme of work that has been absolutely key to transforming how the Morecambe Bay hospitals operates, and really has helped pivot the organisation to one that is data-led and I guess data actions. So the command center is a real-time predictive application written within Qlik Sense, but it's presented in really big scale within a physical command center room, and that room staffed 7 days a week by clinical members of staff, and they utilise analytics presented through the command center app to make decisions all day, every day. So it was a business-led piece of work. We went from ideation, from idea to go live, and that was a physical room decked out with massive screens with the Qlik Sense command center app. installed on it in under 10 weeks. And it was just a great piece of work. And since then, we've worked with Catalyst around iteratively developing the functionality. And it is now, it is the heart of the hospital. We've got one of the command center screens is on the wall of the chief executive's office. We've got people utilising the command center on the mobile phones. We publish it through Qlik Sense SaaS. We've got alerting tied into the command center, Qlik alerting, that is triggering action around the hospital sites. We have patient flow meetings, which are regular huddles throughout the day for clinical operations staff to plan how they're going to manage just the flow of patients through the hospitals, through the system. They're all driven by the command center as well. We're having really significant success around predictive analytics and the use of AI. So we use Data Robot, SaaS, and we're developing a lot of models which are predicting things and offering the opportunity to change the way healthcare is delivered fundamentally. And that's an area which I'm really interested in and see the value of. So we're using Data Robot to predict things like our demand, how many patients we're expecting to hit the hospitals on an emergency basis. We're predicting things like whether a patient would turn up to an appointment or not. We're predicting things like whether a patient will be readmitted in the future if certain care interventions aren't given whilst they're in hospital, so it's not live within the stay risk of readmission. We're also using Data Robot to stratify patients in terms of their risk of them sitting on a waiting list and not yet receiving treatment. So we've worked with Qlik, and we are working with Qlik to utilize Blender as a product to allow us to really tightly integrate between Qlik Sense SaaS, Qlik Sense in the cloud, and Data Robot SaaS in the cloud. And that's really exciting. We're joining that data and then using that to deliver pathway-focused clinical analytics. So, a good example for that is a patient who is perhaps has a severe respiratory condition. We have a chronic condition, and they may be being managed within primary care. They'll go see their GP for care. They may have asthma checkups, or they may have COPD checks. They also may be at such a state that they have periods of emergency admission where their condition exacerbates to a level that they need urgent care. They may be taken by ambulance into the acute hospital. So I guess that's sort of three: primary care, ambulance services, and the acute hospital emergency department. And also that patient then may perhaps require some step down care within a community facility. They may be older. They may have other health complications. They may not be able to. They may not have the care infrastructure at home in place so that they could be safely discharged home. So they may be discharged to a step down facility. And again, another good example of where we're taking data from that care setting as well. We've developed a theatre Qlik Sense app, which is aimed at supporting the transformation of theatre services. Theatres is one of the big areas in healthcare where we know there can be significant transformation in terms of productivity and efficiency and safety of care. So the app was developed within Morecambe Bay Hospital. So another great example of an app developed by in collaboration with the business-led design, delivered by our team. But I guess the real benefit is then taking that approach and layering it into an integrated care system. So every healthcare provider has the same challenges around theatre efficiency, and we've got strong support from our operational leads within our ICS to work with each provider to deploy the same Qlik Sense app into their operational teams. And the objective of that is to both provide a regional view of theatre's productivity and opportunity, So I guess, never before has there been any interconnection between theatre systems across a really large geography of autonomous delivery organisations. So we're giving a bird's eye view of who's been treated and operated on which theatre, what the staffing levels are like, where perhaps the efficiency gains could be made, where there's really great performance in terms of optimization, perhaps where we could seek further efficiency gains through applying AI to things like scheduling or rotoring of staff. But we're also then giving within each organisation a really practical, operational focused application to allow people to understand their business and understand their performance and take action as a result. All of us in reaction to the coronavirus pandemic have had to fundamentally change how we conduct our day-to-day lives, and healthcare has been obviously no different. And there's, like many sectors, many industries, there was a really rapid pivot to digital technologies in response to the challenges that working within a coronavirus environment brings. I think so in terms of uptake, digital transformation, it's regarded pretty well as, it's had a positive impact in that respect. And we've seen a big shift within healthcare to patients being seen virtually. So the delivery of perhaps outpatient care via virtual appointments, delivery of primary care, GP appointments virtually. So one of the things which is of interest from a system perspective, an integrated care system, an ICS, is being able to get a view of centrally how many patients are being seen without having to travel to a health delivery organisation, and what the uptake is around the region, where there are opportunities to further engage patients around virtual healthcare, where there are opportunities to perhaps work with clinical teams and digital teams to ensure there's functionality in place and the sort of the hardware and software in place to enable that type of consultation to take place. So we're working with Catalyst to develop a virtual care Qlik Sense SaaS app, and again that will be delivered across the integrated care system. And that's really not that's of interest obviously to providers, but it's also of much wider interest to primary care and other agencies and stakeholders involved in the delivery and management of care within their system. The UI of Qlik Sense and the ability to create clear and directional analytics is really important to our strategy. And I think a really good example I would give is that we talked about the Analytical Command Center project before, and this was back when we implemented it. And we implemented it, we were sort of working up to a Christmas deadline. We went live just before Christmas, and a matron walked into the command center room. It was brand new. He'd never seen it before. He hadn't actually been involved in the design process. Some of his peers had. And he immediately walked up to the boards, and these were 55-inch touchscreens displaying live predictive flow of patients around the hospital. And he immediately started telling us what it was telling him about how the organisation was working, how it would fundamentally change his ability to do his role, his staff's ability to deliver better care. And that was one of those moments, really. I guess a kind of a business value moment that it was a light bulb moment. It was no training, no introduction, no context, no preparation, and he got it. And I think if we can do that every time, that would be 100% success. Definitely now the staff are enabled and empowered to explore data themselves, to ask questions of data. We're always, in terms of culture, we want staff to feel that they're confident in asking questions about how the organisation is running, being able to argue a case with data, being able to be inquisitive, to challenge. I think we put a lot of focus on data quality. That's probably a really good example where I think there's data quality. The kind of argument is it needs to be owned by the organisation, because data quality is a reflection of data centred within the various systems. We've got a lot of over 300 clinical systems within the hospital, and that means the data sets we're talking about are really complicated and really deep. I think it makes their lives easy. I think if you think of a nurse working on a busy ward, they're really difficult positions, and they're positions where the staff involved they're interested in looking after patients and delivering really high quality care. And so I think, as a supporting a healthcare delivery organisation, anything we can do to make both their job easier, but also augment their ability to deliver better care, to improve the quality of outcome, or the comfort whilst in care, or the speed of recovery of a patient, it needs to be top priority. I mean, that's contributing to the mission of the organisation. So I think where we've got clinical staff, desperate to be included in the alerts we push out through Qlik Sense, for example, to help them cut through the noise and help them really see what's important in terms of, be it, when a patient may be deteriorating, be it when a patient or a bed becomes available for a patient that's waiting for it. Our ability to give them a tool to make it easier to augment their decision-making process is, it's really important. It's rewarding as well. We've got a really strong clinical buy-in to this process. I think lead clinicians understand the value that this can give to a health economy. That helps develop a feeling of trust in data, trust in transparency of the organisation. I think one of the lessons I learned as well, and we particularly as we've focused on live analytics, is don't hide what's maybe not great. And I think that's been a big step change. And when we focus on developing live bed management analytics, for example, we had the support from the chief nurse to just to ignore any people saying, well, this system's not get up to date, or I know that this ward, perhaps they don't admin their patients to the end of the shift because they're too busy, and that's when they get half an hour to update their systems. But we had absolute support from the top of the organisation to run with it, expose any substandard quality of data, and to present the organisation as it really existed in terms of the data footprint. And that, I think, culturally, that's really important. It's been super important having the right Qlik partner and developing a relationship with the Catalyst team. Their interest in strategically supporting us as a healthcare system, supporting us, modernising our product stack, and helping us as a team connect to peers and collaborate with other people interested in analytical innovation around the globe has been really valuable. I really feel like we're in it together. We've seen engagement in usage of Qlik Sense apps massively increase, and we know that we're reaching people who traditionally perhaps wouldn't have engaged with analytics and are doing so as part of their day job. We know that care has been delivered safer, that patients are being treated and discharged more quickly. We've seen significant cultural improvements in terms of organisational buy-in and use of data to drive decision-making. We've seen strong clinical engagement around live, clinically focused analytics. And we've particularly seen pull from the organisation in terms of clinical and operational workflow, allowing users to be alerted when action needs to be taken, exploiting the natural language capability of Qlik Sense SaaS is changing the way that all of our staff are able to do their job, and an empowered workforce, driven by data is definitely happening here. I feel really proud and really excited by it. It's definitely been a journey, and I think it's. I often talk about the journey and the kind of innovation journey around data. It's been really rewarding, and I think I think one of the things I talk about is kind of persistence, and it hasn't always felt easy, but I think it's playing the medium, a long game, and taking the rough with the smooth. I think it's humbling to be able to support the delivery of safer care, more efficient care. I think it's really humbling to be able to support society and use data for good. For me personally, as long as I can keep adding value in that way, then that's what motivates me.